Hi, my name's Angus from HMC Osteo here. Today I'd like to put together a few short videos to help explain a condition that I see quite commonly in clinic, one that can have quite a large effect on your everyday life, that is shoulder impingement syndrome. So shoulder impingement syndrome can be caused by quite a few different reasons, but before we go into those, I think it's important to understand the anatomy behind your shoulder to better understand how this occurs. So the shoulder joint is made up of two bones, your arm bone and your shoulder blade, and they form a ball and socket joint, which allows movement in all directions. Now, you've got space kind of within this shoulder joint, and there is structures which run in through that space there. So up in the top, you've got a bursa, which is a fluid-filled sac, which helps prevent the rubbing of kind of tendons on bone and that sort of thing. You've also got tendons from your rotator cuff muscles, which kind of sit along the back of the shoulder there. Your biceps tendon, the big muscle in the front of your arm there as well, also runs up through that space. And these structures, if they are injured or inflamed or anything like that, they can be causes of shoulder impingement. However, there are also some other factors that may predispose you to getting shoulder impingement. So posturally, if, like most of us are these days, especially people who are working at a desk or anything kind of forwards based, if your chest muscles are tight and your upper back is rounded, that kind of thing, you actually kind of start to close up the space in the shoulder joint. So instead of having that much space, you got that much space, and then when you try and go through movements, can't go as far, gets pinched, is painful, that sort of thing. So basically the main causes of shoulder impingement are like a repetitive strain injury, so an overuse injury. This could be through work, if you say mechanic doing things all day up here above your head, or sports, tennis for instance, something like that, and you're using all your rotator cuff muscles a lot. You can also have kind of bony abnormalities. This may occur just naturally. You may be unlucky and be born with it. However, more commonly it occurs as a general aging process, and the bones can kind of start to degenerate and you get little bony spurs in through there. And then it can also just be due to direct trauma and injury. So maybe you land and squish and everything just compresses up through your shoulder joint, and that may cause injury and inflammation to that area and start to give you these sort of symptoms. I'll move on to another video later which will describe the symptoms of shoulder impingement and then also how we treat it as well.